Hello, Dr. Shing. I'm a Harvard trained and board certified medical doctor specializing in spine and pain. If back pain and sciatica are uncontrolled, an injection can help. But is this right for you? In this video, I'm going to share with you what types of injections are out there for back pain management, and importantly, teach you key factors to consider prior to getting one. If after proper diagnosis of back pain is made, and you're not getting better and not responding to more conservative treatments such as physiotherapy, a medical doctor may recommend an injection to get you better. So, what is an injection? Basically, it's the placement of medication in the body using a needle in order to confer a medical benefit. For pain, this can be divided into two types of injections. Number one, an injection directly into the spinal area of the body causing pain. This is done under image guidance with a medical spine specialist who has training in anesthesia, physiatry, or pain medicine. For an understanding of the different specialties that treat back pain, feel free to check out my other video. These types of injections are also called interventional pain or interventional spine treatments. Again, with the help of imaging, medications can be delivered to spinal joints, spinal discs, spinal nerves, or spinal musculature. The location where the medication is injected matters. If the medicine is placed in the elbow, it won't help with the spine. Similarly, if the medication is placed in the spinal musculature, it likely will not help with the spine disc problem. Therefore, the diagnosis of where the pain is coming from is essential. Here are some examples of interventional pain treatments. Number one, epidural steroid injection, which is the delivery of potent anti-inflammatories used to treat pain from a spinal nerve compression. An inflamed disc or other type of intraspinal problem. Radiofrequency ablation of the medial branch is another technique, using thermal ablation or heat to deactivate the nerves providing sensation to spinal joints, causing pain. There are many other what we call simple procedures, but there are also advanced interventional procedures involving implantable devices to treat spine pain. The second type of injection is typically administered by a non-spine specialty doctor. These are injections that are not administered directly to the area of the spine causing pain, but rather delivered to the body through the bloodstream. For example, an emergency room physician may deliver an injection through a blood vessel or IV to treat someone in the emergency department for acute pain. Another example, in a primary care office, an intramuscular or IM injection is delivered into a shoulder muscle, which eventually enters the bloodstream. The medication is typically a pain medication or anti-inflammatory. The effects, however, unlike the interventional pain treatments, are usually very short-lived and will wear off when the medication is processed by the body, which is typically within a day. Now, I want to end the video with key points to consider prior to considering an injection. Number one, understand the diagnosis that has led to the reason for the injection. Number two, is it the appropriate time for this type of treatment? The trajectory of pain and functioning, as well as whether or not alternative, less invasive options have been tried, factor into this question. Number three, understand the risks and benefits. Make sure you know what is being injected, what to look out for in terms of possible complications, and lastly, what type of benefits should you see afterward and for how long. And number four, potentially the most important aspect that you have control over. Ask yourself, how will I pair better pain control with the proper lifestyle changes, physical movements, health modifications, so that I can properly heal from this injury and reduce the likelihood of future injury? And as always, I wish you health and good guidance on your journey.